I know you're getting a lot of junk mail right now from Medicare companies, and you're probably throwing a lot of those letters in the trash. However, there is one extremely important letter that you absolutely cannot miss, because if you do, you could be stuck on the wrong plan, spending a lot more than you have to in 2026. And we already know that there are over 600,000 people that are losing their plans. Their plans are being canceled this year, and many more announcements coming every day. So how do you know if you're affected? You don't unless you read this letter. I'm talking, of course, about the Annual Notice of Change letter, or ANOC, the Annual Notice of Changes. Now, this letter is not one that you want to miss, because if you do, you don't know if you're one of the people that is affected. Now, at first glance, your Annual Notice of Change, or ANOC, is just another letter about upcoming plan changes for 2026. But the crazy thing is that this is the only document that your insurance company is required to send you before they completely change their terms. That's right, even if they are canceling your plan, this is the only letter that they are required to send you. And that's why it's so important not to accidentally throw it away. Now, some of you are going to receive your Annual Notice of Changes by email. And that's even worse, because how many emails do you receive that you don't read? So make sure that you don't throw this away, that you don't delete it, or that it's not going to your spam, depending on how you receive it. So let's talk about what specifically the Annual Notice of Change letter shows, or the ANOC. I'm going to refer to it as the ANOC. And there are 5 main things that you want to check in your Annual Notice of Changes. Now, number 1, the first thing you want to check is your plan premiums. What is happening to the cost, the monthly cost of your plan? Right now, you might have a Medicare Advantage plan that is a $0 premium. That could be your, we'll call it, your MAPD plan, and it might be $0 a month, right? But it could change. Maybe you have, instead of a Medicare Advantage plan, maybe you only have a Part D prescription drug plan. And let's say that that prescription drug plan is $45 a month, although we know some people who have a $0 a month prescription drug plan. These prices were for last year, and they can change every single year. If you don't check your Annual Notice of Changes, then you won't know if your plan changes. So let's say, for example, maybe your Medicare Advantage plan is going from $0 to $10 a month. Well, you won't know that unless you check your Annual Notice of Changes. Or maybe your prescription drug plan is going from $45 a month to $75 a month. Again, you won't know that unless you check your Annual Notice of Changes. So we see these things happen all the time. And that's how the next year rolls around, and people are shocked when they have to get some prescription filled, or they receive, they have the same plan. It's essentially the same, but the cost maybe is significantly different. So that's why you need to read your Annual Notice of Changes and see what's upcoming, and you can prepare for it. And if there is going to be a big change, you can switch to another plan that is better for you, right, or that costs less. Now, aside from premiums, you'll also want to pay attention to how much you pay whenever you use your plan. So the second thing we're going to call cost share. So cost sharing means what is your share? So what is your share of what you have to spend? For example, let's say that with your current plan, it's $300 a day in the hospital. So maybe in your hospital's day 1 through 3, you pay $300 a day. Well, you know that now. Hopefully you do know that. But if you don't check, maybe it's going up to $400. We don't know until you look at your Annual Notice of Changes. You could have copays that are higher. You could have drug prices that are higher. You need to be aware of all of these. And then with a Medicare Advantage plan, the top of it is your maximum out of pocket, which we like to call MOOP. So your maximum out of pocket. Maybe your maximum out of pocket is, $3,000. Well, it's $3,000 now, but is it going up next year? You're going to find that in your Annual Notice of Changes, and you'll know what it's going to be. Now, what is that maximum out of pocket? That $3,000 means that once you have spent $3,000, you don't have to spend anything else for the rest of the year. It's the worst case scenario. That's why a lot of people like choosing plans with lower maximum out of pocket or lower MOOPs. That way they know that their worst case scenario is, in this case, $3,000. We've seen plans that it can be $5,000, $6,000, $7,000, $8,000. We've seen plans in some counties that it can be much lower than that, even as low as $1,000 or $750. But you won't know what yours is, and it can go up. And we're seeing a lot of changes for next year. So you need to make sure that you look at your ANOC and know what's going to happen. Now, the third thing is network. Your plan with a Medicare Advantage plan has a network. You could come into January and find out that your doctor is no longer in the plan. If you're not careful, you may be forced to see another doctor instead. So the good news is that if you read your annual notice of changes, I said I was going to say ANOC, and I keep trying to say the other one, and I stumble over myself. Annual notice of changes. It's hard to say fast. Read your ANOC. You'll know if your doctor, if specialists, if hospitals, or even pharmacies. So with a prescription drug plan, you have a network too. It's the pharmacy network. So you need to check and see if your pharmacy is going to be in the network. Now, if you're someone who likes to have a PPO plan, we're seeing a lot of changes coming for 2026 with PPO plans. And a lot of people like PPO plans because they can go in and out of network at reasonable prices. But this can change. And if you don't read your ANOC, you might be surprised at just how much you're going to pay to go out of network on your PPO next year. Okay, now the fourth one. This is one of the most critical ones to pay attention to, and it is changes to your drug formulary. Now, a drug formulary is the list of covered medications in your plan. We see too many people that get caught off guard by changes to their drug formulary. This year, they're happy, and they're happy with how much they're paying for their prescription drugs. But in January, they go to get their meds refilled, and they're shocked to find that the prices have doubled or tripled, or worse, they find that their medications are no longer covered. This is because the plan made a change to their formulary. So remember, a formulary equals covered drugs. And if your drug is no longer covered or is covered differently because the formulary puts things in tiers, then it's going to cost you a lot more. And that formulary determines how much you're going to pay for your meds. Now, you don't need me to tell you that prescription drugs are easily one of the most expensive parts of healthcare. That's why if your prescription drugs move within a plan's formulary or get dropped from the formulary without you realizing it, it can be devastating to your wallet. Now, finally, number 5, which to me is the most crazy, it is to check if your plan, oh, you know what? I don't know my numbers. This was supposed to be number 4. Sorry, guys. Number 5, is your plan closing, going out of business? That's crazy. This is the biggest surprise to people, that your plan could be going out of business, or they could be choosing not to offer coverage in your area anymore. We are already hearing that over 600,000 people are going to lose their coverage in 2026 because some of the biggest insurance companies are shutting down their plans in certain areas and certain counties. Now, legally, I can't tell you the name of the companies, and I can't tell you what's changing until October 1st, but I need you to be thinking that you need to look at your annual notice of changes so that you are aware when it happens. Now, you'd think that if your plan was closing, your insurance company would call you. They would come knock on your door. They would do everything they could, send a carrier pigeon, right? But no, the only thing that they're legally required to do is to send you your annual notice of change telling you that they're closing down. So again, we already know that this is going to affect 600,000 people in 2026, and the number keeps going up every day as we hear about new things. Now, if you miss your opportunity during annual enrollment and your plan goes out of business or chooses not to offer coverage anymore, then on January 1st, you're not going to have that plan anymore, and you'll be put back on original Medicare. And remember, on original Medicare, you have to pay approximately 20% of all your medical bills, in some cases more, and in some cases less, and there's absolutely no limit to how much you could spend on original Medicare. That's why, I know I've said it 100 times, look out for your ANOC. But okay, what if you've read your ANOC and you find that these changes are here and you don't like them? What can you do about it? Well, the best thing that you can do is take advantage of this main time of year where you can switch to a better plan, where you can make a change and move from one insurance plan to another plan. Now, during Medicare's annual enrollment period, or AEP as we like to call it, you have the opportunity to make a change to your plan, and you can change from the plan you're on to a plan that fits you better. What can you do during annual enrollment period? Well, during annual enrollment period, you could join another Medicare Advantage plan, MAPD, Medicare Advantage Prescription Drug Plan. So you could join another Medicare Advantage plan. You could also, I'm going to call it switch, which is, another word for join another, switch your prescription or Part D plan that if you have a Medicare supplement. So this is for people with Medicare Advantage, they can change their Medicare Advantage plan. People with a Medicare supplement, they can change their Medicare supplement plan during annual enrollment period. Now, when When can you make that change? Well, the timeline, I'm sure you're aware, is from October 1st to December 7th. That is the time when you can make a change. And remember, there may be a lot of plans during that time that are available in your area to have different options and things that you're looking for. So if you need help to change from one plan to another, then look for help from a licensed insurance agent. And don't hesitate to call us using the number on your screen. We are happy to help you, of course, at no cost to you. We are compensated by insurance companies, but the people who work here are paid salaries. And so it doesn't matter to them which plan that you choose. They just want to help you to make sure that you're covered. So that was the how. How do you make a change? Well, work with an insurance broker. A broker means someone who works with more than one insurance company. Work with an insurance broker. Of course, there are other options. You can, do it yourself. Please don't do that, but you can. You can do it yourself. You could contact an insurance company directly. I'm not even going to write that on the board. Don't do that. Their only incentive is to sell you something, right? So those are things those are ways that you can change your plan during annual enrollment period. Okay, let's talk about when you should expect to receive your annual notice of change letter or ANOC letter. It should come in the month of September. If you don't receive it by the end of September, there's probably something wrong. It should come between the 1st and the 15th. So you're looking for this letter from September 1st to September 15th. Of course, it's telling you what is going to happen next year, but you're actually going to get it before the start of annual enrollment period. Because remember, annual enrollment period starts on October 15th. So you have this as much as a month in advance to know what's changing and to know that you need to start looking for other coverage if something major is changing, right? Now, traditionally, you will get your annual notice of changes through the mail. But nowadays, a lot of insurance companies are sending it to you through email, and it's because you've opted into digital communication, right? And in a time when there's so much spam, it's very easy to accidentally just delete the email. But don't worry, if that happens, if you get to October 15th and it's approaching and you haven't received your annual notice of change letter, you can contact your insurance company. Call them to take out your card, turn it over. There's a phone number on the back, right? Call that number and say, I have not received my ANOC and I need to know what's changing in my plan. And that way you'll know exactly what is coming for 2026. And you can decide if you want to switch to a better plan for you or stick with your current coverage and your current plan. So remember, the how is you get it either by letter or by email. So be watching for either the letter or the email. And lastly, if you have not seen anything, SOS, right? What is going on? Then you can contact your insurance company. You call them on the number on the back of your card and say, I have not received anything. I need to know what's changing. That's the SOS scenario. Again, I would say if it's getting to October 15th and you haven't heard anything, make sure you call them. So keep your eyes open for the ANOC. You can throw away all those spammy letters from insurance companies, but not the ANOC. Because remember, you don't want to miss on the main enrollment period, which is annual enrollment period. But if you're on a Medicare supplement plan and you're wondering if you should switch to a Medicare Advantage plan, if it's worth the savings for you, then check out this video next, where I do a complete cost breakdown between Medicare supplement plans and Medicare Advantage plans.